Hi guys, Dr. Celestine here. Now, I want to talk a little bit about what pregnancy risks that the general population or my patients worry about versus what I actually worry about. So let's get into it. The very first one is that everyone's worried about sex with a pregnancy. And I just want to be clear, the male genitalia is not touching the baby in any way. So for most people, this is not risky. What I worry about is if you are someone that has a risk of preterm labor, or if you have something called a placenta previa, where the placenta is covering the cervix, that's when I worry more about things kind of touching the cervix, again, not touching the baby. But the baby's actually very cushioned in there in the uterus with the amniotic fluid. What else I worry about is actual activities that are a little bit more rough where the baby can get hurt, such as horseback riding if you fall off the horse, or if you're doing some sort of dangerous activity where a hard impact to the body actually affects the baby, but not intercourse. Another thing people worry about is gaining enough weight, especially in the first trimester when most people are nauseous and vomiting. So sometimes you do lose a little bit of weight with that too. But if you're only losing a small amount of weight and we're, getting ultrasounds done, overall, your baby is gaining enough weight, I'm not too worried about it. Most people do lose a little bit of weight in the first trimester because of the food avoidance, the nausea, the vomiting. I'm not so worried about that. Usually your baby is fine, and vomiting in early pregnancy is actually a good sign. I know it sucks, but it's a good sign. What I actually worry about is if you can't keep any food or water down, and if you're losing a significant amount of your weight, such as 15% of your initial weight prior to pregnancy. That's when I get a little bit more concerned for something called hyperemesis. So not as concerning the everyday nausea, vomiting with a little bit of weight loss. Happens all the time. A third thing people seem to worry about a lot is delivery, and if they're going to poop in the delivery. Now, lots of concerns about this. Most people do poop in delivery, and as a doctor, again, I am not that concerned. I'm actually excited when you're pooping in delivery. You know why? Because that shows me that when you're pushing in the right spot to help the baby descend into the pelvis and out for a delivery and to meet your child. So again, as an OBGYN, not as concerned, actually excited. And we just swipe it away. No one's paying attention to that. Don't worry. I do get more concerned with delivery is looking at your baby's heart rate pattern, looking at how well your baby is descending into the pelvis, looking at your contraction pattern, the baby's position. I'm not so worried about your pooping, I promise you. The fourth thing people worry about a lot is thinking that they are going to have a C-section. Now, I will say in America, we don't have the best average C-section rate, about like 32% in our country, so a little bit higher than others. But what I do tell people is that my plan and most plans for OBGYNs is not a C-section. We're trying for the vaginal delivery. But C-sections do exist for a reason, and they save a lot of babies. They can save a lot of mothers when used appropriately and for the right indication. So I just wouldn't worry so much about having a C-section right off the bat. I would say as long as you pick the right GYN or the right OB for you and you're on the same page of the type of delivery, you feel comfortable with their decision making, to not worry about that so much. There's a lot of other things that are a little bit more concerning or a little bit more needing to put focus on as opposed to that. But in our country, we can do a little better with C-section rate. It's true. And one thing that people do get really concerned about that I'm a little concerned about too is hair dyeing, or especially in the Black community, hair relaxers during pregnancy. Now, these do have chemicals, and the research is very mixed onto whether or how much gets absorbed, how much it affects a pregnancy or a baby. So in general, I would say avoid it, especially the hair relaxers during a pregnancy. Try to embrace your natural hair in your natural hairstyles in order to just eliminate those risks, while the research and the reviews are still very mixed. Some are saying it's absolutely affecting a pregnancy and a mom. Some are saying it's not. Just avoid it during pregnancy, and hopefully we'll study it a little bit more soon.